Well, good afternoon, everyone. We'll go ahead and get started. It's right at 3 o'clock. And my name is Deepak Madala, and I'm a healthcare attorney at the Virginia Poverty Law Center and also direct the Enroll Virginia project. I'm going to be hosting today's webinar on the public charge rule and health coverage options for immigrants in Virginia. Just a little bit of background. Enroll Virginia is a network of both navigators and CACs throughout Virginia. We've been operating in the Commonwealth since 2013, and consumers can reach us through a variety of means, including offices throughout the state, a toll-free hotline, and through our website, enrollva.org. And if you go to our website, enrollva.org, you can also find a map which can help you locate most of our offices. Before we get started today, I just wanted to do a few notes to help you kind of navigate today's webinar. First, more importantly, today's webinar is being recorded, and the slides that will be presented and additional resources will be shared after the end of the session. This session is also being interpreted live into Spanish by our outreach manager, Amber Perrone. So if you look on your webinar controls, you can find a tab for interpretation, and if you select the Spanish language, that can help you access that feed. Carla, are you able to interpret that into Spanish for us? That's all right. Well, go ahead. If you're able to see that, so you click on the interpretation tab and then select the Spanish language, and you can get an audio in Spanish for this entire presentation. So today presenting will be, first will be Kat Lundy. She's from the National Immigration Law Center. She is a state and local policy analyst with them, and we're really excited to have her join us and share her information about the public charge rule and some important updates that happened earlier this year with that rule. Following her will be Sarah Cariano. She is a policy analyst with the Virginia Poverty Law Center with me and also our lead navigator for the Enroll Virginia project. And then finally, Carla Torres will be presenting, and she's been a navigator with us since the beginning at the Central Virginia Legal Aid Society here in Richmond, Virginia. And if you have any questions for the presenters, you can use the Q&A tab on the webinar controls to ask a question. We're going to be waiting till the end of the presentation to answer most of the questions, but please use that to put in your questions as we go along. So before we get started, I wanted to launch a quick poll to just get a sense of who we have on the call today and your kind of understanding of the public charge rule itself. Yeah, thank you very much. Yeah, the first question is just asking about if you work with an organization that serves immigrants, what type of immigrants do you serve? And the second question is just your level of understanding of the public charge rule itself. Okay, thank you. That's pretty good. We'll end the poll so you can see these results. A nice variety of There we go. You can see those results there. We've got, yeah, pretty wide variety of types of immigrants that we serve, and also a wide variety of understandings of the public charge rule. With that, I'll go ahead and turn it over to Kat to start the webinar.
Thank you. Yes. Hi, everyone. My name is Catherine Lundy. I'm with the National Immigration Law Center, where I'm a state and local policy analyst. I am also a former Virginian and grew up in the Hampton Roads area, so I'm really grateful to be able to do a presentation today with folks from my home state. Thank you for filling out those questions. I find it really helpful for these presentations to get a little bit more of an understanding on where people are at in the room with their understanding on public charge and helping to build upon that. So today, on the next slide, you'll see where what I'll be covering, which is understanding the fear and distrust that exists within immigrant communities and where some of the sources of hesitation comes from. I'll go over the specific public charge policy, who it applies to, who it doesn't apply to, and what benefits are considered in the public charge test. And I will end with some know your rights information for immigrant communities when it comes to accessing healthcare, so going to the doctor or enrolling in health insurance. Next slide, we will start with understanding where the fear comes from. And there are a few things that contribute to this. One is a historical context of exclusion from public programs for immigrant families, today's context, and some of the recent developments in anti-immigrant rhetoric that has contributed to the chilling effect. Chilling effect is a fancy term that researchers have used to describe the fear of enrolling in a public benefits program because someone thinks that they might suffer an immigration consequence or repercussions from using a government service. So on the next slide, we'll go into a little bit more detail on what is sort of underlying all of this in the public charge rule. It's that immigrants have historically been excluded from programs. So the level of misinformation that exists within generations of immigrant families is longstanding. And the fear or confusion around using public benefits is also longstanding. So you'll see the Social Security Act of 1935 deliberately discriminated against farm workers and domestic workers, making them ineligible for a lot of the programs that were created to overcome the Great Depression and the economic decline of the 1920s. In the 90s, you saw with PERORA. PERORA is a fancy, PERORA is an acronym for the Personal Responsibility Opportunity Reconciliation Act, a long term for this bill that basically even further created exclusion for immigrant access to public programs. And then lastly, another example would be with the Affordable Care Act in 2020 that deliberately created a carve out for DACA recipients from being lawfully present in terms of being able to access healthcare. The next slide, I'm not going to say everything that's on the slide, but I just wanted to point out where the public charge rule comes from a historical sense. This is a map of the United States from 1880, and back in these days, there was no such thing as federal immigration policy. Every state in the country actually had their own immigration laws that applied to anyone that wanted to move or settle within that particular state. So public charge is a part of some of these old historic rules, but for the most part, these rules applied mainly to newly freed Black slaves and Black communities as a way to deter certain people from being able to move from, say, southern places to northern places. It wasn't until 1882 that the government decided that there needed to be a federal policy that governed all of immigration, particularly at times when there were far more immigrants coming in through Ellis Island and through Angel Island. But I just wanted to show that public charge is a very, very old, long-standing policy. And on the next slide, we'll bring it back to modern times and today's context. over the past 5 years, there have been a lot of increases in the anti-immigrant rhetoric that is used, both in the media, with policymakers, in all levels of government, and in news everywhere. So you see this list here. A lot of this is, for people that aren't in immigrant communities, they sort of see these individually, but for immigrant communities, it's compounded. They feel all of these impacts of hate at one time. So it contributes to this feeling of being unwelcomed and hesitancy towards engaging with government more than they have to. On the last slide, I'm just going over, these are some of the sources of fear. So on the next slide, we'll go into a little bit more, So the chilling effect, as I mentioned, is a term that is used to sort of describe what happens when there is this fear on accessing programs. So people may not want to enroll in a public program or choose to disenroll from a public program because they fear they might receive different treatment. They fear that their information might be shared with immigration officials. They fear that they may not be able to get an immigration benefit like a green card or DACA status, whatever that might be, or they also fear deportation. So the spectrum of what people are afraid of when they're deciding to not enroll in public benefits is also very varied. Okay, on the next section of the webinar, I'm going to go over what is public charge policy, and I'm going to try and break that down very simply into a 101 of the policy. Go over some know your rights information when it comes to enrolling in health insurance and going to the doctor. And if you were to take anything away from the presentation, it would be the top 5 things to remember about public charge when you're dealing with immigrant clients or clients that are concerned about using public benefits. All of this information can actually be found on a website, and I can put the link in the chat box, but www.protecting immigrant families, that's protecting immigrant families in English.org. There's probably a shorter link that I can also share, but everything you see here today can also be found on this website and in probably more detail too if you're interested. The next slide, I'm going to go over where did this policy come from. This will feel a little bit like an American Civics and Government 101, but I think it's helpful in understanding where the rule came from and how we can change it and what is the future of the rule. So at the bottom of this list, you'll see we have the Constitution of the United States. It's the fundamental principles on which all of the laws of the land are built upon. It's incredibly hard to change, and there's actually not a whole lot of immigration policy or immigration law that's embedded within it. Then a level up, you have bills and legislation. These are things that grant us rights and privileges. They're passed through Congress with a sign-off from the president, and they must follow that fundamental principle of law in the Constitution. And for example, with the ACA, the Affordable Care Act, that was passed through legislation. However, these bills don't have all of the little nitty-gritty details that it takes for an agency like HHS or the Department of Health and Human Services. It doesn't tell them how to enforce or implement these laws. So a regulation or rule that is created at the agency level helps implement and enforce these policies. Now, with regulations and at these agencies, that is at the total discretion of the executive branch or the president. So it was used a lot under the last administration and the administration before to create a lot of changes that couldn't be done in Congress. It's not that the president has unchecked power when it comes to creating regulations, but it is very close to that. And this is where the public charge rule comes from. It's in bills and it's in legislation, so it's in statutes. And the regulations that we're going to talk about in a little bit come through the agency specifically. On the next slide, I'm going to talk a little bit more about what public charge is specifically. So public charge refers to a person that is considered to be primarily dependent on the government for support. Now, longstanding history of this rule means this is a person who is completely destitute. Like they would have to rely on the government or government aid for the rest of their life. The it's a forward-looking test. So when they're doing this test, they're looking at the circumstances of an immigrant now to make a determination for the future. Overall, when immigrants are submitting applications to the government, they have their paperwork and the government goes, yep, you filled out this form. Yep, you've supplied all of the necessary documentation. Public charge test is this additional level of vetting that is done where they look at all of an immigrant's circumstances to determine if they are likely to become primarily dependent on the government in the future. And they look at a variety of factors that is known as the totality of circumstances test. And we will get into what I call the ABCs of public charge. And on the next slide, we're going to go over what A is. And A stands for who does public charge apply to? So the number one thing you should...
just a quick, the interpreter is asking just to slow down just a tad on there to help with
okay.
on the Spanish. Sorry about that. Thank you.
No worries. On the next slide, I'm going to talk about A, who does public charge apply to? The number one thing to remember is that public charge does not apply to everyone. I would repeat, public charge does not apply to everyone. It primarily affects family-based immigrants that are applying for green cards, but many people will not face a public charge test. I'm not going to read everything that's listed on the slide you see here, but as you can see, there are a lot of people that are not subject to a public charge test. So when you're counseling with clients that might be concerned about public charge, the number one thing you want to look at first is whether or not public charge even applies. If it doesn't apply, or I would look at this list to determine whether or not it applies. On the next slide, we will look at what benefits are considered in the public charge test. There are only two types of public benefits that would be considered if the rule applies to the immigrants. These two public benefits are a form of monthly cash assistance, so things like Social Security income or temporary assistance for needy families. The second type of benefit would be long-term institutional care at the government's expense. And when I say institutional care, I mean like a nursing home that's paid for by the government, or someone that basically has to live in a hospital for the rest of their life. Those are the only types of benefits that are considered in the public charge test. I will also remind folks that most immigrants that are applying for a green card are ineligible for these types of benefits. So the overlap of people that are applying for green cards and have access or are eligible to use any of these services, it's a very, very small group of people. For the next slide, which is C, is this last part of the test, or basically the holistic view of an immigrant's circumstances. So officials in the government, when they're doing the public charge test, they're looking at a lot of different things. This includes age, skills, employment, education, but an affidavit of support, in other words, a contract that a sponsor will sign for an immigrant that's applying to come to the United States, is typically enough to overcome this test, because the sponsor is basically saying, I promise to support this particular immigrant while they're in the United States so that they don't become a public charge. But immigration officials really do look at a variety of different things. So maybe, yes, someone doesn't have a job, but they have a lot of income or assets. Or maybe someone doesn't have a lot of income, but they have a great job waiting for them in the United States. Or they are very, very healthy and are at a very good working age. Overall, immigration officials are looking at all of these different pieces holistically, and whether or not someone has used public benefits is actually only one piece of this entire test. So the next slide, I deliberately did not mention what happened over the past couple of years because I really wanted to drill into people's minds what the actual policy is today. The policy as it exists today is what I just explained, but I think it's helpful to explain why this was kind of a big deal over the past couple of years. And just really briefly, again, I won't read everything on these slides, but when the last administration took office, we got a leaked executive order that was published in the Washington Post about potential changes to public charge. It would have, if the changes had become permanent and had gone into effect, which they did, but for a short-term basis, it would have created a lot of problems because of that chilling effect that I described earlier, this fear of enrolling in benefits. And the new rule that the last administration had put forward, actually, we have documented evidence that it did contribute to a level of fear in communities about accessing public services. Eventually, through a lot of roller coastering of, sorry if that word doesn't translate into Spanish, there was a roller coaster of litigation updates, but eventually the rule was completely stopped by this new administration, and that rule that existed before is no longer in effect. It had changed fundamentally the definition of public charge. It added additional benefits to those that can be considered, like Medicaid and SNAP. But thankfully, that rule is no more and it's no longer in effect. On the next slide, the next 3 slides will be some other important information on rights and privileges that immigrants have when they're accessing health services or enrolling in insurance. So everyone, including undocumented immigrants, have the right for emergency healthcare services. Hospital emergency rooms have to help anyone who needs emergency services, and community health centers also must help anyone. ICE or immigration enforcement are generally prohibited from enforcement or carrying out enforcement activities at healthcare spaces. So there are specific rules and regulations that prohibit officers from going into what is known as a sensitive location. So this includes courthouses, daycare centers, schools, and healthcare centers. The next one here. A healthcare provider should not ask about immigration status unless they are helping an individual enrolling in, applying for Medicaid or in insurance. And if someone is applying for health insurance for someone other than themselves, for example, like their own child, they also do not have to provide their immigration status. If they're asked by the individual on the other end of the line about their immigration status, they can say, I'm not applying for myself, I'm applying for whoever the family member might be. On the next slide are a couple more bits of information on enrolling in health insurance. So reminding folks that many immigrants are eligible to get health insurance and in some cases help paying for the health insurance under the Affordable Care Act. Immigrants have a right to get free help with language interpreter when they're getting health care. This includes when they're enrolling. This includes when they are applying for Medicaid or CHIP or another plan with the government. There are rules that hospitals and health systems have to have this sort of equitable language access. So we recommend that folks ask for these services if they need them. I would also share that there are a lot of rules that protect benefits applicants' information when they apply for public benefits. So the information provided, like their names, their addresses, that information is only to check and see if they're eligible for the benefit and then for distribution or administering the actual benefit. It is not shared with ICE. It is not shared with immigration officials. It stays protected. And then lastly, receiving health insurance does not impact, receiving government health insurance does not impact your immigration status. So this is that relationship to public charge. Reassuring folks that there are, unless you're looking at long-term institutional care, The benefit I described earlier about having to basically live in a hospital or having to live in a nursing home, unless it's that type of benefit, which again is very rare for immigrants applying for a green card to even be eligible for, there is no impact on immigration status when you are enrolling in government health insurance. The last slide I have, and I'm sorry if I think I might be a minute over, is the top 5 things you really should take away from today. Is that number 1, again, public charge does not apply to everyone. There are so many groups that are exempt from public charge. Number 2 is that most public benefits that exist do not impact a person's immigration status or their future applications. I know we got this question a lot when there were all these new COVID relief programs, the stimulus checks. We got a lot of questions about these in particular, but there are so many public benefits that public charge does not apply to. It's just those 2 on the previous slide that I had shared. Number 3 is that only a few benefits considered, the 2 that I shared. Number 4, that non-cash benefits used by family members, or if your family member is using a non-cash benefit and you're afraid that it might impact your status, those are also not considered in a public charge test. One example might be if someone is applying for a green card and their child uses SNAP or their child uses CHIP. That has nothing to do with the applicant's green card. That child is still allowed to access all of those programs, and their use of that will not impact the immigrant's green card application. And then the last one, number 5, is that personal information that you provide to the government when accessing public benefits is not shared with immigration enforcement. There are specific protections on applicants, people applying for public benefits, and how that information can be shared and stored. And that's it from me. Thank you for having me.
Yeah, thank you so much, Kat. That was wonderful. Thank you so much. And I did see we got a couple of questions. I know someone's got their hand raised. So we'll hold for just a couple more minutes. We'll have Sarah and Carla present, and then we'll have plenty of time for questions at the end. So Sarah, let me get your presentation up.
Great. Good afternoon, everyone, and thank you for joining us. It's really exciting to see such a large group. So I'm just going to cover really briefly, Deepak, you can go ahead to my first content slide, the immigration eligibility rules for Medicaid here in Virginia. Medicaid is a program that is part federal, part state run, and so the rules are going to differ depending on which state you're in. And the first thing to note is that it's really complex and the rules often change. And so this is really going to focus on just the immigration piece. But as an overview, to be eligible for Medicaid, an individual will have to meet both financial and non-financial factors. So financial being income or income and assets, depending on the category of Medicaid. And also based on the category, there are different age limits. There's different rules for immigration status for different categories. If someone is pregnant or a parent, other special factors as well. So it really is a complex program that in some ways is several different programs under one big umbrella. Also, just note that eligibility may differ for each household member. So often we'll see parents who are not eligible, but children in that household are, because the income limit for children is simply higher. Deepak, you can go to the next slide. And this is just a list of all the categories of Medicaid and FAMOUS, which is what we call our CHIP program in Virginia. Most people who are enrolled are either going to be in the children's group, the pregnant women's group, or the category which we call age blind disabled in Virginia for our seniors as well as individuals with disabilities. But there are a lot of different avenues into Medicaid. And so I just wanted to put this up there so you could see kind of the breadth of the program before we dive a little more deeply into the very specific immigration requirements. Next slide. And on that slide, you'll see at the previous slide, I had the federal poverty levels for the largest categories within Medicaid and CHIP in Virginia. And I just wanted to put this up here so we had a little more context in terms of the financial, the income requirements for the main category. So the new health coverage for adults is what we call Medicaid expansion. That's going to cover our non-pregnant adults from 19 to 64. The income limit is up to 138% of the federal poverty line. There's no asset or resource limit for this category or the pregnant women and children. Pregnant children and women can be eligible for Medicaid or CHIP up to 205% of the federal poverty line in Virginia. Again, no asset or resource limit there. So next slide. So when we're talking about the eligibility criteria for immigration status, again, this is just one piece of eligibility. So we're going to see, is the person eligible based on this? And then do they also meet the income requirements? Do they also meet the other requirements? Sometimes I think we get really deep into this and you're like, all right, the person has an eligible immigration status and kind of forget to look at the other factors. So just because someone meets the immigration requirements does not mean they're necessarily eligible. We need to look at all the other requirements as well. There's really one large distinction within Medicaid for our non-citizens. The children and pregnant women's groups are much, much broader. And so if you are working with a child or a pregnant woman who has legal status that is not expired, they're probably meet the Medicaid immigration requirements in Virginia, because we have expanded our program to the kind of broadest place possible under federal law for this category. So children under 19, pregnant women have to be what's considered lawfully residing. And really the only exception to this is that, unfortunately, as Kat pointed out, folks who are here and have status through DACA are explicitly excluded from Medicaid as well as the Affordable Care Act. Applicants for certain statuses, when we're talking about children and pregnant women, are also considered legally residing. And this is primarily the SIJV applicants, as well as applicants for asylum. There's special rules here. If the child is 14 and under, they can have an application that's been pending for 180 days. And then they would become eligible. Others, if they have a pending asylum status, but also have a work authorization for the children and pregnant women, then they would be eligible. When we talk about Medicaid and non-citizens, we also often hear the 5-year bar. Just want to be really clear. There's no waiting period for children or pregnant women. There's no 5-year bar. And lastly, Kat pointed this out earlier, but the parent's immigration status does not affect the child's eligibility. The parent doesn't need to declare their immigration status or social security number or anything on the application, or the adult filling out the application for the child if it's not the parent, for that child to be found eligible. A few special notes about Social Security. Some statuses, when we're talking about, for example, a derivative of a student visa, don't come with Social Security numbers traditionally, and the individual should not be requested to access one simply for Medicaid. So we've helped, pregnant women who have visas based on their spouse's visa, and they themselves haven't gotten a Social Security number. They don't have to get one just to be enrolled in Medicaid for that program. And again, parents or other adults applying for children or other family members are not required to provide a Social Security number on the application. Deepak, next slide. And I wanted to very specifically call out prenatal famous is a new category in Virginia. It just went into effect 2 months ago, July 1st. And it is coverage for pregnant women regardless of their immigration status. So this is going to cover our undocumented women who have income underneath that 205% federal poverty line. It is full benefits. It is not, even though it's called prenatal famous, it is actually comparable to our other pregnancy-related coverage in Virginia, which is comprehensive benefits, even including dental. And it goes 60 days postpartum. It actually is the last day of the month that your 60th postpartum day occurs within. So some people get a little bit more because it goes through the end of the month. Women have to be pregnant and a Virginia resident. Both of these are able to be just self-attestation on the application, unless there is some reason to doubt those things, which would have to be a pretty extreme circumstance. Uninsured at the time of application, and ineligible for other Medicaid CHIP programs based on immigration status. And really that just comes down to if someone is eligible for another famous moms or Medicaid for pregnant women, we want them in that category versus this category. So next slide, Deepak. Now here's where it gets a little complicated, right? We want to remember pregnant women and children, unexpired status, you're here legally, you probably meet the eligibility requirements. But when we're talking about our non-pregnant adults, things do get a lot more complicated. So if you think back to Kat's slide about the different legislation that has happened federally over the course of the year, 1996 may ring a bell. It was that quote unquote welfare reform that did limit immigrant access to benefits at that point. And so we have a hard cutoff, August 22nd, 1996. If you arrived before that, your requirements to get Medicaid, to have an eligible status for Medicaid, are looser than if you arrived after August 22nd, 1996. So if you arrived before, you'll see this full list of statuses that would qualify you for Medicaid without a waiting period, without work history requirements, anything like that. Deepak, you can go to the next slide. So we don't frequently at this point see a lot of folks who have arrived before that August 22nd, 1996. Most of the folks that we're working with in Enroll Virginia, the enrollment program, have arrived after that. And so the calculation is, if you are a legal permanent resident, this is where that 5-year bar does apply. A legal permanent resident who has had that status or qualified status for 5 years continuously meets the Medicaid eligibility requirements. Previously, Virginia was one of 8 states that also had a 10-year work history or 40-quarter work history. That was removed back in April. And so if anyone has worked with families who were previously denied because they did not have a work history, they absolutely should reapply now because that requirement is gone. There's no work history requirement for Medicaid in Virginia. Then there are 2 exceptions. So there is a list of, we call them 7-year immigrants or special 7-year rule. And Deepak, you can go to the next slide. And certain veterans, active duty members, and their families. They also don't have to be an LPR and don't have to have that 5-year presence. So our 7-year immigrants are this listed here. And you'll see there is a lot of crossover with the list of eligible immigrants who arrived before 1996. But it is a shorter list. So for example, parolees were on that earlier list. They're not on this list. So it's really important to kind of note when someone arrived and then make sure you're looking at that full list. And they meet Medicaid's, these individuals will meet Medicaid's immigration eligibility criteria for the first 7 years that they are legally present. After 7 years, they will no longer have Medicaid eligible immigration status unless they have adjusted to become a legal permanent resident or naturalized. If someone does adjust to becoming an LPR or naturalizes before the end of the 7 years, they don't lose this special 7-year status. We just want to make sure we're indicating on the Medicaid application that they entered as a refugee or that they gained asylee status 5 years ago and just transitioned into becoming a legal permanent resident. Also just want to point out the last bullet point here, because I know this is a population I've had a lot of conversations about recently, is the Afghans admitted into the United States under a special immigrant visa. So some of the current asylees and refugees coming from Afghanistan right now do have SIV status. They should be treated as 7-year immigrants. They should not, they absolutely have eligible immigration status. Some folks coming in are special immigrant parolees. And we have gotten word from DMS, and CMS, but I don't have it written yet, that special immigrant parolees should also be treated as 7-year immigrants. However, if someone is just a regular humanitarian parolee, they do not meet the 7-year criteria, and they would not be eligible until they either were approved for asylum or adjusted to becoming an LPR and had that 5 years presence. So I know that's a little complicated. I'm happy to answer questions about that in the Q&A. I'm also happy to answer questions offline. My contact information will be readily available for everyone. Next slide, Deepak. And then emergency Medicaid. So emergency Medicaid covers emergency services only, labor and delivery, kidney dialysis, accidents, and it is for folks who meet all of the other Medicaid requirements except for immigration status. So they have income, they're a resident, they have the age for the children's category, the Medicaid expansion category, but they don't meet the requirements for full Medicaid. In these instances, they can apply to get coverage for that specific incident, that specific medical emergency. I just want to note Medicaid expansion did actually broaden who is eligible for Medicaid, because we broadened who is eligible for Medicaid generally. So the category, anyone who fits in that category but can't get Medicaid because of their immigration status can get emergency Medicaid. And we want to help folks do that if possible, because they don't end up with an emergency bill at that point. It kind of protects them. It also protects the hospital because they get paid for services. And you would have to apply for this, generally speaking, with the exception of dialysis after the incident had happened. But Medicaid can go up to 3 months retroactive, and so you can still get that service covered. Next slide. And lastly, there is, an option, and Kat pointed this out, there is an option for folks who can't get Medicaid because of their immigration status. They can get Affordable Care Act coverage through the marketplaces. Here in Virginia, we use healthcare.gov still. Again, DACA and undocumented individuals are excluded from this. The financial assistance is based on income. For everyone else, financial assistance at the marketplace only starts at 100% of the federal poverty line. If someone cannot get Medicaid because of their immigration status, but they have income below 100% of the poverty line, they can still get tax credits. And this is the only group that gets this special treatment. So again, if you're ineligible for Medicaid because of your immigration status and you have income below 100%, you are still eligible for tax credits on the marketplace. I think there are a lot of people across the nation and in Virginia who could be getting really, really low cost plans and coverage and don't, because this is something that's just not terribly well known. But unlike Medicaid, where you can apply year-round, individuals do have to apply during open enrollment or a special enrollment period. Deepak, I think that's all I have. So again, here's my contact information. And Carla, you're up to give us the tips and tricks on how to actually get eligible folks enrolled. So thank you all so much for your time this afternoon.
Thanks, Sarah. Hello, everyone. I am Carla Torres. I am Healthcare Navigator with Enroll Virginia and Healthcare Navigator Coordinator with Central Virginia Legal Aid Society. I have been working with immigrants for about 14 years, and I'm here to share a few tips that they have been working very well in our program. Deepak. There are two key questions that we ask when we do outreach. One is, where is the population located that we want to reach out? Then you need to figure out what area the target population lives in and focus on that living situation where they can be found. It could be that they live in mobile home parks. It could be that they live in housing complex, in certain area, in a county. Once you can figure out the common living area, you can post flyers there and posters with your information in shopping centers, grocery stores, and businesses. You may also want to consider to target the CVS pharmacies. This has been working out very well with us. People go there to get the vaccines and the COVID test, and then you can also go and post posters in the free clinics in your area. You could also attend local community events, especially in rural areas, such as family school events, back to school events, immigrant social groups, and organize workshops for outreach. It has worked very well with us, organizing workshops with small groups of families in schools. Next slide, Deepak. So another key question that we ask is, what organizations are already working with each specific population? Identify and work the organizations that they're already working with the population that you want to reach to build some trust. In that way, you're not reinventing the wheel. Some examples that we work with are the Consulate on Wheels, the Hispanic Chamber of Commerce, free clinics, organizations working with refugees, and also any nonprofits that they're working with immigrants in your area. Communicate with partner organizations frequently by sharing flyers with new policies and participating in their events. Also consider doing Facebook Live events with partner organizations to help disseminate the latest information and have other organizations share the event on their own Facebook pages and those videos. That has been very effective for us. Next slide, please. There are some special tips that they have been working very well for our program. Follow community trends. Like, as you all know, COVID-19 has had a huge impact in our community and has provided a clear path to connecting with this hard-to-find population. I heard a great example of this was attending vaccination clinics in our area to find uninsured people. With so many people losing employment, this has been an important way of connecting with people. Other examples include sharing flyers at places such as at VSC events and at VSC locations. Other food pantries, we have been attending events in food pantries and posting flyers at the locations with the VSC. We're also partners with the Rapid Response team, and they have been giving out all of our flyers. Church events that are targeting all these organizations, they're targeted to helping more people that they're being really impacted by the pandemic. Partnering with community organizations, there are places where the population frequents. Partnering with community organizations that are in places where the population frequents in order to communicate important healthcare coverage updates. An example of this is the recent change with the famous prenatal program that allows women, regardless of immigration status, to have health coverage during pregnancy. Outreach through organizations such as gynecology clinics, midwifery clinics, and the Caravan, they effectively communicated this change to patients who they were already receiving care and they are already eligible. Next slide, Deepak. Adapt to changing environments and try new ideas. One way that we have implemented this was making informational bookmarks with our logo. And this was suggested by one of the local libraries that they were working with us. And this turned out to be very popular, and now it's an important part of our materials. Another positive, new, effective outreach method we used through the public library system was publicizing our flyers on their websites. Organized radio, television, newspaper, magazine interviews through partner organizations. Many times these interviews would be free of charge, and when done through a radio of the population target's language, it is a very effective channel of communication. You may also consider placing radio ads through population-specific radio stations if your budget allows. Ensure that all flyers and all posters and all outreach materials, that they're in the target outreach languages. Deepak. Attend local outreach and network meetings in the community to be connected to new ideas. Work with programs within partner organizations, or best say like within your organization to maximize referrals. It works very well with us to work with our intake program, with their rent relief facilitators. They're located statewide and you can connect with all of them, or even with your migrant program. Understand that the target population's unique challenges. These challenges, and you might know all of them, is communication barriers, knowing how to work with an interpreter. Like today, I think we're going way too fast. Communication barriers, lack of transportation. Sometimes during the pandemic, we have been working with the phone, and the appointments have been over the phone, but oftentimes we know that people cannot come to the office, and then we meet them in libraries that are closer to them. Understand the cultural differences. The application appointments usually take double time if you're working with an interpreter, so you need to book 2 hours in advance. There are also certain beliefs and superstitions related to healthcare. When considering how to do different types of outreach, you need to be aware of those. Next slide, Deepak. When doing outreach and enrollment, familiarize yourself with the language line or another translating services, and encourage other people to do the same so that consumers are reached in their own language. And the last tip that I have today is consider empowering your target communities by explaining how the healthcare system works so they're able to become more independent as they learn little things. And these little things could be how to obtain their cards, how to get a referral to the specialist, and things like that. And the last closing thought I have for today is regulations in healthcare are always changing and challenging for us, and so is outreach. So adapting to new trends and trying new approaches and tools is the way to succeed. Thank you very much for listening today.
Thank you so much, Carla. That was wonderful. And Sarah as well. Yeah, so we did have a couple questions that did come in through the chat box. And you can also welcome to use the Q&A tool as well. Let's see here. I may have answered this a little bit in the chat there, but Liz Moore had asked a question about long-term care services where the services are being provided through community-based care services and whether that would be considered part of institutionalization for long-term care.
Hey,
Sarah?
this is Kat.
Okay.
I went ahead and added it to the chat, but I'm also happy to follow up with folks individually if they have more questions. But for the purposes of public charge, home and community-based services are not considered institutionalization, sorry, long word, for long-term care. But I'm happy to follow up if there are more questions, because we do get a lot of questions specifically on long-term care and how the government is defining that. So I'm happy to share more resources on that.
Thank you, Kat. Yeah, and I'll also point out on that type of a question too, it's again, kind of the first point that Kat had shared in her presentation that, you know, it's not common for immigrants who might be subject to the public charge rule, which are limited, to even be qualifying for those type of benefits. So the next question from Floor, asking adults with asylum pending and a work permit and they want to apply. There's a similar one in that. Sarah, did you want to answer that one?
Yeah, unfortunately, if it is a non-pregnant adult, they would not be eligible for Medicaid. If they do have the work permit, however, that they would be able to get into the marketplace. So the ACA, healthcare.gov marketplace, and get substantial tax credits if they're below, you know, Medicaid levels. And so I would encourage them to look there.
And it says here, DACA recipients, do we know, can DACA recipients apply for the new prenatal FAMOUS program?
Yes, yeah, so DACA recipients would fit that requirement of being ineligible for other Medicaid categories based on their immigration status. So primarily it is, you know, will likely be undocumented women, because there's just more undocumented women than DACA recipients, but both would be able to be eligible for that category, as well as emergency Medicaid for other emergency services.
Yeah, I think another question is about pending applications. I think that was similar to the last question. Anybody else have additional questions? You're also welcome to use that feature to raise your hand on the participant box, and I can allow you to chat with us. And maybe while we're waiting for some more questions to come in, maybe you can provide a little bit more information, because I know we've been getting a lot of questions, Sarah, about the new Afghan arrivals, and just a little bit about, I think, even how people can contact us or contact you to get more information about that, or any of the kind of questions. If someone is helping an immigrant client and they want help with, you know, just navigating health insurance and what to figure out, because sometimes there are a lot of immigration statuses that we just need to research and figure out more. We can help. And yeah, go ahead, Sarah.
Yeah, I would just say, you know, my first line on my first slide was, it's complicated. I've been doing this for a good number of years and still pretty regularly have to look it up in the Medicaid manual or reach out to national folks on some more difficult cases that I'm just unfamiliar with because I'm not an immigration expert. So I at first encourage folks to reach out if you have questions or help. And if you go to Enroll Virginia's website, there's actually a map where you can find the local office. Again, my contact information is in the slides, which will be shared, and you're more than welcome to reach out to me directly with questions. I'm very specifically talking about the new Afghan arrivals. So again, those who have special immigrant visas, adults, children, pregnant women, all will meet the Medicaid eligibility criteria. If they don't have Social Security numbers, they may end up being enrolled in the Refugee Medical Assistance Program, which is the same Medicaid application. It's just if they're basically all the paperwork hasn't been completed yet, it gets them into coverage more quickly. And then once they have all the paperwork down the road, would be transitioned into Medicaid. So don't let someone not having, you know, a Social Security number yet or the application fully completed for that yet deter you from helping them apply. If they have that SIV status, they will get Medicaid one way or another, or at least they should. And again, if that's not happening for folks you're working with, please do reach out to us. The part that we're still waiting on some more guidance from both CMS, which is the Center for Medicare and Medicaid Services at the federal government, as well as the Department of Medical Assistance Services here in Virginia, which is our Medicaid agency, is those folks who are entering as parolees. Some will come in as special immigrant parolees, and they should be treated the same way as the SIVs. We just don't have written guidance on that yet. And so again, please keep in touch with me if you are working with these folks, because I've been asking CMS, and I know that they're working on written guidance, and hopefully we'll be able to distribute that, you know, to our staff and partners soon. If someone is a humanitarian parolee into the country, they generally speaking are not going to be eligible for Medicaid as a non-pregnant adult, but the children and pregnant women are, and then those non-pregnant adults again can go to the ACA and purchase coverage. Now, it does have some costs. There are still some copays, but with the income below 100%, folks do usually get very substantial subsidies, as well as what are called cost sharing reductions, which bring down the deductibles and out-of-pocket costs as someone accesses care. So again, it's a little bit of a moving target right now as we're looking for guidance, but please be in touch. And again, those SIVs and any children or pregnant women really shouldn't have a problem. It's just going to be the non-pregnant adult parolees that we need to keep a closer eye on.
So we had a question about, again, the new program, the famous prenatal program. Can women with an expired ID apply and not be denied because of it? I think, yeah, go ahead and answer that, Sarah. I think it's more, I think the ID itself does not establish immigration status, whether the status is expired sometimes, but yeah, go ahead, Sarah.
Yeah, so at first I would say it's, again, I should have said this earlier. So for all Medicaid and CHIP programs, it is one application. And so do the application. If the individual has status, even if the ID has expired, they will likely be enrolled in either Medicaid for pregnant women or famous moms. If the status itself has expired, so they're undocumented, then they would be enrolled in prenatal famous. And honestly, the different categories have a lot more to do with the inner workings of how things are done with Medicaid than the benefits that the individuals are going to be getting. Virginia, down the road, has applied to extend our postnatal care in our famous moms and Medicaid for pregnant women program to a full 12 months. And when that goes into in effect, that's going to be the one really big difference between the programs, because prenatal famous will still only continue for 60 days postpartum. But those legally residing women, citizen women who are in either Medicaid for pregnant women or famous moms will get a full 12 months of continuous coverage postpartum. But that's not in effect yet. And I just think it's really important for that reason that if someone is legally residing, though, we do get them into the famous mom, because when that goes into effect, we want to make sure that they can access that full length of postpartum benefits.
So right at 4 o'clock, we have one more question just came in from Mary Mays. It says, for DACA, are they eligible for anything if they're not eligible for emergency Medicaid? I think I'll clarify that. You go ahead.
Yeah, unfortunately, they are not eligible for full benefits, Medicaid or ACA coverage. The only thing they would be eligible for is the emergency Medicaid, and if pregnant, the famous prenatal coverage.
Well, thank you, everyone. Thanks for joining us today. We got the question a couple of times, but we will be we did record today's session, and we will be sharing the link to the slides and additional resources to everyone who registered with the webinar. So we'll be sending out a link by tomorrow for that. But thank you, everyone, and thanks to Sarah, Carla, and Kat for a really great presentation today. Thank you.